So mnemonics is the stuff that we have been doing for the past 1 week. I try to compile mnemonics for all those fossas, mnemonics for all those triangles, different triangles and all that, alright? So going on this, we'll be talking about mnemonics to remember contents of the occipital triangle, alright? So at least you guys will see the pictures of occipital triangle, know where it is, and most importantly, the contents, okay? Because when they want to talk about the applied anatomy of the occipital triangle, then definitely they should be talking about the contents. So this is the occipital triangle, all right? You can see that it is like posterior to the neck, right? So what I have here, yeah, this is the occipital triangle, okay? But I feel like this image would be better for us to illustrate, okay? So looking at the contents of the occipital triangle, we'll talk about the contents first before we come back to talk about anything mnemonics. All right, the spinal accessory nerve, all right? So this is even a better image for that. So spinal accessory nerve is here. Then we have 4 cutaneous branches of cervical plexus. 4 cutaneous branches of cervical plexus, right? And these 4 cutaneous branches, they include lesser occipital, all right? Lesser occipital nerve, this is it here. We have great auricular, this is it here. We have what? Anterior cutaneous nerve of neck, not indicated. Then we have suprascapular nerve. This is what I have here. Suprascapular nerve, not indicated. Do I have it here? Not indicated. So I feel like this image was not to talk about the contents of occipital triangle, okay? So the next we have occipital artery. This is occipital artery, close to the occiput, close to the back of, okay, your head. Then we have the transverse cervical artery. Transverse cervical artery, not indicated, but of course the transverse cervical artery is nerve is there to guide you, and most of the times when you see the nerve, the artery follows it. Okay, so guys, these are the contents of the occipital triangle. Some of them we saw them in the picture, some we weren't able to see them, but it's your duty to use your atlas to check it out. Okay, so you see this 4 cutaneous branch of cervical plexus, just grab it as 4 cutaneous branch of cervical plexus. Even if you are not able to know them one by one, just grab their common name, okay? So we have 4 contents, all right? So what is the mnemonics for this? And the mnemonics, I would like us to follow accordingly to what we have here, all right? So S fourth, all right? S fourth is the mnemonics we are going to be used. S is spinal accessory nerve. F is what? 4 cutaneous branches of cervical plexus. O is what? Occipital artery. T is what? Transverse cervical artery. Okay, so just recite this, and you'll be perfect in knowing the contents of the occipital triangle. S4. Okay, so see you guys